The story of ECEWS is a story of God's gift to humanity.
It's a fiery passion that was contagious enough to bring other people on board.
The journey of ECEWS so far has been sacrificial.
Simply a miracle.
The impact of ECEWS is enormous.
Begin to count that to see quantifying in terms of numbers really is not what you can really put a number to.
In 2001, nobody really knew where this was going.
If a vision is pursued with integrity and with purpose and with passion, it is possible.
Every great movement begins with a question. In 2001, a group of teachers in Akwa Ibom looked at the future of young people in Nigeria and asked, what are we leaving behind? Schools were struggling, communities were hurting, and many had stopped believing change was possible. But a few people refused to accept that. What began as a small gathering of Christian graduate teachers would become ECEWS.
ECEWS actually started as an idea, a strong idea to cause change, basically within the education sector. And we remember vividly saying, look, no child is a dunce. Every child can actually make it if we put in the energy and the time. And that was a time where the motivation of teachers was waning intensively. They were ravaging, examining some more practice scenarios which is unfolding. And for me and a few of our friends that we came together, it was more of, can we actually cause these children to think differently?
Back in the day, we used to do seminars in schools, workshops, donated computers, printers to different secondary schools.
I remember someone, Andy, who came up full of vision to change the paradigm in the educational subsector, talking about the menace of examination malpractice that was very erratic in those days, and here he came with the big idea of changing that paradigm.
Zeal for success, that was just fading away, particularly for kids in public schools. And so I think for us, this was a strong driver, and then up until in 2003, when the issue of HIV and AIDS education became prominent for us, and issues around computer education was also a big issue. So we had both computers coming, and health education sealed it to us through HIV and AIDS education.
In rural communities, access to technology was almost non-existent. So ECEWS introduced computers into schools where many students were seeing one for the very first time.
We also had partnered with Centers for Youth Empowerment based in the US, who had brought in loads of computers, and we're able to tell them, look, we're taking this to the schools. And that bettered one of the most important revolutions in computer education in Akwa Ibom State, where we took computers to over 20 schools.
We've seen how far that goes right now, how important it is. Like you can see, I have my laptop in front of me, and imagine that 80% of the work I do is on my system. Imagine if I wasn't, computer literate, how would I be able to work? So we saw that then, and we tried as much as possible to train some children on computers, how to use a computer, and then to ensure that whatever it is that they do in future, they will need the computer, they will need the literacy for computer to do their jobs.
It was more than digital literacy. It was exposure to possibility. The mission was simple: help young people rediscover discipline, integrity, and hope for the future. But beyond the schools, another crisis was unfolding, and ECEWS chose not to look away.
During this intervention, we noticed that there were gaps. We noticed the gaps in healthcare. We also noticed the gaps in, social safety net not being available.
ECEWS branched into medical health intervention, and I think that is the greatest area that ECEWS has made an impact. The intervention has been amazing because people who otherwise had no future, no hope of being alive, of living in excellent health, ECEWS has been part of the reason why their story has been turned around.
As communities faced growing healthcare challenges, the organization expanded its reach, stepping into spaces where support was urgently needed but rarely available. From education to public health, one thing became clear. ECEWS would go wherever people needed them most. With new partnerships and growing support, ECEWS expanded its work in health interventions, supporting families and strengthening access to care for vulnerable communities. Across the riverine communities of the Niger Delta, healthcare workers traveled by canoe, carrying testing kits, medical supplies, and hope to communities many systems had overlooked for years. For ECEWS, service was never about convenience. It was about people.
When you see the mandate for ECEWS from the beginning, it was targeting the most difficult terrain. Looking at people who are in difficult to reach environment, the most vulnerable population. So from the beginning, it was people. We were all intentional about ensuring that we reach out to the people in the most vulnerable setting in Nigeria and wherever we work. So it wasn't challenging for us. We are local. First and foremost, we started from Akwa Ibom, and in Akwa Ibom, we come from villages. So we had to take the messages to our various communities. So when we said we want to help a community, we were working not only with ourselves, but also with the community stakeholders, the gatekeepers of the community, to identify their needs and look at how best to help them.
The ECEWS vision is always a vision to resolve our family. And that's actually that if I'm able to, touch life to a mother, by that way, touch life to the family, touch life to the children, that person can extend that to see. So that's always our approach to where it is. And speaking of that, give a typical example now. ECEWS in our health intervention, currently, as it actually has over 300,000 people living with HIV. They are under that care. Imagine the life of these people, keep these people to continuously live their life and continue to be a breadwinner to their families.
Then came a turning point. From 2007 to 2014, funded by the U.S. Centers for Disease Control and Prevention, ECEWS implemented the MAC4 project. This major public health initiative pioneered mobile counseling and testing across the riverine terrains of the Niger Delta.
We heard about the MAC4 project, and it was supposed to be in Cross River State. So it was through Nkawforiba, one of our partners then in the US, that informed us about the MAC4 project from CDC. They told us that the US government may not understand and don't know all our problems, but we can justify why it should be brought to Akwa Ibom. And of course, the CEO, who doesn't give up, took it up, and we were successful to get the first US government project, which we call the MAC4 project.
Having written that grant sent to us by Nkawforiba women who saw the RFA in Atlanta and sent it to us. I had written some few grants, but this was a real changing cause, because by the time they said, go look at it, I said, okay, this was so large, but on the second of looking at it, we now said, this could be it. And we got inside of the RFA, and by the time we came off with an idea, the MAC4 project was bettered.
Through the MAC4 project, ECEWS reached over 200,000 individuals. The project laid the foundation for ECEWS's long-term capacity to manage large-scale, internationally funded public health programs. Building on this experience, ECEWS would soon take on an even greater challenge in the fight against one of the world's deadliest infectious diseases. Funded by the U.S. government, the Challenge TB project took ECEWS into hard-to-reach mangrove forests, screening over 440,000 people in communities where many did not even know they were sick. ECEWS understood early what others were slow to accept. Health and economic dignity are not separate conversations. Partnering with Nkawforiba USA, they provided seed grants to ultra-poor market women in Akwa Ibom State.
There's a program that we call the Market Women Empowerment Project. In that project, across Akwa Ibom, we have helped over 300 poor women in the market. People we are talking about here are real vulnerable people. Some of them were getting okra. They go and get it from somebody on credit. They sell it maybe 2,500 at the end of the day. Sometimes that was what they use as their take-home meal for the day. So those who were selling boga fish, grey fish, or at the end of the day, that's what they were going back with. refunding the money that they sold and then getting whatever is remaining of that. So if a mother has 3 children, one will be selling crayfish, another one will be selling okra, another one will be selling maybe fish. So at the end of the day, maybe one fish will remain after selling for 2.5, a few okra, and that's what they go back with. But through the Market Women Empowerment Program, we trained these women, and then we provided them with seed money to kickstart their businesses, scale up what they were doing. And we got the Market Association to monitor them. We've had a real success story across board where these women have grown their businesses, from small to medium scale enterprises.
More importantly, we expanded to financial literacy for them, simple basic financial management, so that they're able to know how to actually reinvest their resources, but also is providing technology, some telephones, so they can actually communicate with their clients. So in that way, they're able to accommodate additional other people to expand their business, so this other community can also build themselves. By that, we are rebuilding a human system that feels, yes, we can.
As the organization grew, so did its impact, from education to expanding health interventions across multiple states and advancing economic strengthening initiatives. ECEWS evolved from a local initiative into a national force for community health and development. But beyond the numbers were real lives being changed. A young child finding the courage to dream again, a father rebuilding stability for his family, a child experiencing freedom and inclusion for the first time. These are the stories behind the work, stories of dignity restored, of futures reclaimed, of communities strengthened. For 25 years, ECEWS has moved toward people, across classrooms, across rivers, across vulnerable communities, choosing service, choosing compassion, choosing impact. What began with a question became a movement, and today its legacy lives in healthier communities, empowered families, and countless lives transformed. This is ECEWS. This is 25 years of impact and excellence.